As we speak, companies are revamping their employee benefits plan to be compliant with the Affordable Care Act. But a look behind the scenes shows that in doing so, it may not be such a quick fix. With rising healthcare costs, companies are struggling to make the math work out in their favor. A recent study by the HCMS group found that by incorporating a standalone vision plan into a benefits package is a great way to manage healthcare costs. In fact, that same study found that employers could save over $3,000 per employee with diabetes over 4 years. With me today to help us understand some of these numbers is Susan Egbert, Director of Eye Health Strategies for VSP Vision Care, the largest not-for-profit vision benefits company in the country. Thank you, Susan, for being here.
Thank you, it's a pleasure.
Susan, can you tell me how spending money on vision care benefits can save companies money?
Sure, absolutely. So first, to point out that the eye exam is a really powerful tool, not only to help people see better, but also your eyes are the only place where the blood vessels in your body can be seen without surgery. So the eye doctor has the advantage of identifying eye-related conditions like cataracts, glaucoma, macular degeneration, but also to identify signs of systemic health conditions like diabetes, hypertension, and even high cholesterol. So identifying those conditions early and getting people into the healthcare system early is really where the employers can save money before those conditions impact productivity and healthcare costs.
Now, Susan, taking a look at the study, it seems that eye doctors are the first doctors to be able to identify serious health issues in their patients. Can you tell me a bit more about that?
In this study, taking diabetes as an example, the VSP eye doctor was the first to identify signs of diabetes 34% of the time. And that's because more people go in for an eye exam than they go to see their doctor if they're not experiencing symptoms.
So it would be at that point that the patient could start treatment. So what happens next?
So when the doctor identifies a condition, they refer the patient to their primary care doctor, but also they report that data to VSP. And VSP works with most health plans to share that data to ensure that the patient gets appropriate follow-up care. And that, as I mentioned earlier, is where the cost savings really comes in. That early intervention and treatment really helps to manage those conditions early so that it doesn't impact the patient's health or the healthcare costs for the employer.
So Susan, I'm still trying to wrap my head around the savings of it. So can you give me an example of a typical employer scenario?
Sure. So if you take an employer who has around 1,000 employees, for example, and they have the typical demographic and health status mix, for that employer, they could potentially save around $80,000 over the course of a few years through this early detection and intervention.
That's a significant cost savings. So this is all from just getting an eye exam?
Well, the eye exam is certainly a significant part of it, but through the eye exam, identifying those conditions early, getting those patients into treatment, that's really where that savings comes in. But looking at productivity, turnover, as well as healthcare costs was all part of the HCMS study, and so that all contributes to the savings.
Susan, tell me a little bit about how this study worked.
We worked with HCMS to identify 6 common clients, and HCMS had their healthcare data. We combined that with our vision care data to look at that early detection and the treatment for those patients. We then extrapolated that to look at our 60 million member base, and it came out to be about $5.8 billion savings over the course of about 4 years.
Great information. Thank you so much, Susan, for being here.
Thank you.